Planning and Infrastructure Expo Conference 2025. Panel Discussion 6, Building World-Class Oncology Infrastructure to Deliver Excellence in Cancer Care in India. May I now request the panelists to join us on the stage. The moderator of this panel will be Architect Shruti Gupta, Healthcare Facility Planner, Max Healthcare. Ma'am, please can we have you on the stage? Give her a big round of applause, everyone. Dr. Anushuman Kumar, Principal Director, Onco, Max SS Hospital, Noida. Dr. Anushuman is a surgical oncology MBBS gold medalist PMCH Patna, MS Surgery AMU Aligarh, MCRC Edinburgh UK, MCH Oncosurgery gold medalist GCMRI Ahmedabad. Dr. Dinesh Pendarkar, Director Oncology, Sarvodaya Healthcare. He is the Director, Medical Oncology, Hemo-Oncology, Bone Marrow Transplantation and Cell and Gene Therapy. Dr. Sapna Verma, Oncology Radiologist, Apollo Hospital. She is the Senior Consultant and Academic Advisor Radiation Oncologist, Indraprastha Hospitals, Delhi. More than 25 years of experience in radiation treatment for cancer patients. Now we proceed with the panel discussion.
Thank you, Mike Gate. Thank you, Mr. Afzal, for creating this. So whenever we talk about cancer, cancer does not happen to a person. It is a family disease, it happens to the family, the whole family starts suffering. So the cancer diagnosis and treatment is very stressful, and the right decisions for the complete infrastructure can bring a change and make an aid to the patient across the globe. But I think it is the most suffering topic or the department of the complete healthcare industry. But in recent decades, we have seen many headlines around the cancer care. With technological advancements, we are bringing a lot of beam therapies, proton beam therapies we are adding that we'll be eventually discussing. But sir, what do you think, even after so many introductions of clinical trials, treatments, applied research into cancer, my question is to you, Dr. Anushuman sir, who is my mentor also. It's such an honor to be sharing a dais with him again. So what do you think, sir? How can we improve the status of oncology?
Yeah, good evening everybody. अब मैडम ने पूछा how we can improve cancer care in India. तब मतलब मान तो लिया इन्होंने कि improvement की जरूरत है. Where do we stand? When we talk about India, India is not Delhi. दिल्ली में रह के सब कुछ बहुत अच्छा लगता है. हमारे मित्र दिनेश साहब जब पूरे हिंदुस्तान भटकते हैं, इनसे पूछिए भारत क्या है. The cancer scenario in India is really skewed. एक साइड 5-star फैसिलिटी है, दूसरी साइड बेसिक क्लिनिक सेटअप नहीं है. And when we talk about the cancer care or cancer deliverable system, spectrum is P2P. Prevention, pills and procedures means chemotherapy, medicines, surgery. Then comes a spectrum of palliation. ये जो बड़ा स्पेक्ट्रम है, इसमें heterogeneous distribution है. Number 1. Number 2. 76% of cancer care facility being catered by private healthcare sector in India. When we talk about cancer, first question comes into mind: cost. Cancer का इलाज तो बहुत महंगा होता है. Can we reduce it? Answer is yes. We'll discuss. And third one, is cancer curable? The answer is cancer is preventable even. Then obviously it is curable. Therefore, to make it more attractive, flawless discussion on cancer care, an acceptable model for India, we have to customize our own model. India is not a country, it is a subcontinent, big country. And many countries reside inside India because of heterogeneous culture, custom, distribution, cancer demography, everything are different. Therefore, we will proceed, and I request Madam to involve the participants as well. They can give their feedback so that we can answer them their question properly.
Thank you, sir. So, my question next is to ma'am that I also belong to a corporate hospital chain, and we these days see a lot of corporate radiation oncology coming up. A huge investment in this sector is happening when we are talking about expanding infrastructure. We are coming up again with a lot of proton beam therapies across India. As far as I know, we are also building it max, and the setup cost is approximately, the civil I am only talking about, is around 300 CR. And then when we add the equipments and everything, it goes around 400, 450 CR. That's a quantum of cost that we are investing into just building one time type of beam therapy. Whereas we see the contrast of the basic beam therapy that is not even accessible to the patients in India. Even when we have talked about that we are going to expand at district level, that will be taking sir's opinion, Dr. Dinesh's. But right now, ma'am, what do you think that what is the awareness, education, how is the reach to the this contrasting variation of patients across India, giving our Indian economy strength?
Thank you, Shruti. Thank you, Afzal sir and Medgate for being at such a good conference and academic discussions going on all levels. So the oncology, as Dr. Anushuman has said, that cancer is something which is really not for the patient, for the family, for the generations. It affects them emotionally also, financially also, and physically. The patient झेल ही रहा है इन चीज़ों को. Now the thing is what Shruti is asking, that since we are in corporate, like I'm at Apollo, they are in Max. So everything, we are coming up with the proton therapy, which is the high-end precision therapy. And at certain level, we are not able to provide to the basic radiation also. So I think we have to bridge the gap with the government, the private and the public setup. And recently in 2024 budget, Nirmala Sitharaman Madam has, reduced the cost duty on 3 expensive medicines. Like, sir must be knowing, the osimertinib, all these medications, they have reduced the duty. And even the question of reducing the duty, import duties on radiation machine is also in pipeline. So, and we have to provide, since India is developing in all sectors, we can't say that we don't have this thing. Rather, patients are going abroad to get proton therapy. That money is being taken, it's in India itself. Patients are coming from abroad to get treatment because proton is very expensive in Western countries. That is costing almost, $100 lakh. And while in India it is just $30 lakh only. It's around 30 lakhs. So we are providing the same international treatment at 1/4 cost. And also we are coming up with like insurance. Insurance, I remember people used to do at 2 lakhs initially, then it came to 5, 20 lakhs. Now there are companies which are providing us with 1 CR insurance because the demand is there and patients are taking care of their health. And Tata Memorial has come up. So NCI Jhajjar is coming up with proton. So I think both sectors are coming, public also and corporate also. And we have to provide the good treatment, and cancer we should try to control and cure. That is, the cure is what he's saying. Cure is the word which is really everyone wants, but cancer can recur any time. So we have to treat and retreat the patient with so many therapies, and we should try to do as much as possible at both the ends. That we have to do the treatment for even at the basic level also and higher end also.
But sir, what do you think that in India we have emphasis on family, but whereas we see Western countries, they have focus on individual autonomies and patient-centric design, patient-centric care.
There's a very good demographic study on that. Especially Southeast Asian population, they believe don't tell, starting from disease disclosure, don't disclose disease to the patient, disclose to the family, number one. Don't give economical or financial burden to the patient individual, tell to us. This is Southeast Asia, means India, Pakistan, Burma, Myanmar, that is Myanmar, Sri Lanka, Bangladesh. Japanese, South Korean, they believe that first order relative only, either parents or children, they should be aware of the cancer. And American and European, they believe individual autonomy in the finance as well as consent disclosure. That should be my autonomy, not the family. This is custom. And we can't change the custom because it's not a new one, it's in our DNA. We evolve like that. Slowly, yes, India is changing. As we are changing in the economy, changing in the culture, transmigration of border, getting marriage, DNA exchange, we are also changing. But still, India believes in family disclosure, family economy, and that way. Madam was saying, we have to make clear, cancer can recur, but larger than that, cancer is cured. That is more impressive. The majority of the cancers are cured. Yes, relapse, that is the reason cancer is being labeled as villain. Number two, 3 duty-free drug. That should be clear. Afzal bhai yaad hoga, hum logon ne program kiya tha. We have made it clear the day budget was being announced, one day before that, Finance Secretary of UK visited India, and just to welcome them, only 3 molecules of AstraZeneca has been made duty-free. And total consumption of that drug in India is less than 1%. If we really want to help the population, we have to fix the majority prices, not the less than 1% price of AstraZeneca. Only one company, which is UK-based company, just to impress that minister, our government has given that budget. Therefore, cancer economics, when we have to understand, try to understand from the philosophy of a clinician who is also looking at the admin part, who can tell you the better. And only then we can come to a policy making which can be implemented in a country like India. Otherwise, imagine the GDP of America, US. Out of that GDP, 17.8% is American health budget. In India, low GDP and only 1.9% is our health budget. We can't sustain anywhere. If cancer is progressing like this, our whole money will go in black hole. Ultimately, we can't save our people.
Sir, you have spoken really blunt right now, talking about black money. So, sir, given this economy also, and ma'am also mentioned the budget, your involvement into the development at the root level has been very vibrant pan-India. You have been working very closely at the district level for the masses. Sir, what are the offerings that this budget has come up for the cancer care at the root level?
Thank you very much for this question. And first, you have to know that it's a vast country and there's a vast divide. But one thing is very clear, that we have to continue to grow with both the angles. We cannot stop improvement and we cannot stop purchase of proton. We have to go that level also. At the same time, we have to see how I can uplift the other angle. We have to work with both the ends because there are people who can afford this. We want to show that we are a top list country in the world, so we have to improve here. I cannot just say that, no, don't make a good hospital. You have to focus on a good, high quality care. At the same time, I have to focus on how I can bring up the people who are not getting the care. So in this budget, there was a very good announcement, a great announcement that Government of India is planning to create district cancer care centers in all 750 districts of India. So let me tell you why this decision has come up. Because I have been working on this model for last 11 years from 2014, and we have been able to prove to the government that government district hospitals in the government system can provide some quality of some level of cancer care in government district hospital using existing government hospital, existing doctor, existing infrastructure, and existing drug resources. This is already available in 200 districts of India, and this is being offered free. This treatment and this, to access this, patient does not require even an ID card, Ayush card, Ayushman Bharat, nothing is required. So government is definitely trying to help people, no doubt about it. And if you want to know the list of drugs, believe it, in Odisha, 120 drugs are free. In Rajasthan, 150 drugs are free. Madhya Pradesh, 70 drugs are free. Himachal has just finalized 130 drug list free. So government is definitely trying to reach to that level. So this is an alternate model where the cancer care is being expanded using existing resources. I cannot have an oncologist everywhere. I cannot have a radiation machine everywhere. But this is doable. This is already happening. So with this scheme of Government of India going to the districts, to 750 districts, I am confident cancer care will definitely improve in the country. What needs to be done now? So offering cancer care, palliative care and chemotherapy is easy. Now what is required is rationalization of surgical resources and radiation resources. So government should come up with some plan of rationalizing radiation machines, how they are placed in the country, and rationalizing maybe surgical oncology services in existing medical colleges. If we really do these two things, cancer care can be taken in a good shape all across the country for a common man.
Sir, given your expertise into chemo, sir, how can we balance the high cost of cancer treatments, especially these, considering the factors like treatment duration, response rates, and patient population with their potential benefits?
No, see, the cost is already being balanced by the government. These drugs, these services are being offered free. Government medical colleges are offering free radiation. So the cost is being taken care. Yes, we'll have to expand the list of drugs, but with the improving economy, the list would improve. It is not a huge cost. Believe it, if it comes to the government level, the cost is not huge. It's really very small. I can't exactly disclose with the budget because it's really small, but believe it, patients are getting what they deserve.
I'll also like to add that not only government hospitals, but also corporate. Like we are giving patients to EWS categories also. And that is almost at 1/5 cost. So like Max is also treating and Apollo is also treating, Tata Memorial, everyone, HCG. So they are catering not only the paid patients, but also the government-sponsored patients also. So which are paying at a lesser cost. And everyone is, we have to increase the facilities, the infrastructure, then only the cure rate will increase. Because we have to make it available, everything, the surgery, the radiation, and the chemotherapy. Drugs are, I think every government hospital, as sir is saying, they are getting free chemotherapy drugs. So patient has being benefited, and we are working for the progress of the treatment.
Yes, free chemotherapy drugs and free treatment by the government. But my question is, who is monitoring that free chemotherapy drug? Means bioequivalence of the product. And number two, monitoring of the treatment means that is being monitored by IS officer who has read the history textbook, not the medical textbook. How can you ensure that that is being monitored properly if the entire country start giving free treatment to all the patients with the same model?
Absolutely, very nice. So I want you people to come up with the idea and help the government to do this. Monitor, please, welcome to monitor. Why you are not coming up and monitoring it?
If you ask me what is the idea is very simple. Just like IS, IPS, there must be IMS, Indian Medical Services. After MBBS, all doctors should give the exam. There are only two options, either go to the clinical side or go to the admin side. Admin people will become joint secretary, health secretary, and clinical people will become oncologists and cardiologists. Very simple. But do you think country or leaders or bureaucrats, do they want doctors to monitor the system? No. The answer is no. Because doctor is the softest target who can be targeted. And policymaker can sit in the air-conditioned room, handling 86 portfolio at a time. In airlines, pilot can handle only 7 portfolio. 7 portfolio can be given to a pilot because human brain can handle maximum to 7. If he get distracted, another co-pilot is there. But our DM handles 86 portfolio at a time. Humanly, it is not possible.
Right, sir. So we have Dr. B.K. Rana also sitting in the audience, and I would like to talk about regulatory frameworks. So evolving regulatory frameworks for healthcare and cancer care versus, sir, your recent experience with the Western country. So how was your journey in the past, I think 20 days, sir? Would you like to share that experience?
See, now India has changed. India is not British rule India, it's a Bharat. Previously, we used to lack in technology, money. Corporate healthcare sectors had fulfilled that gap. Now we are equipped with good quality technology, all upgraded machines. I went there to train German doctors in robotic cancer surgery. Imagine the situation. Then they asked me how it's possible. My answer was simple. Now we are not British government. Now it's an Indian governance by the people, for the people. We have the money, we can purchase same Da Vinci robotic system what you are having. We have larger expert and skilled people to handle those machines, and we have higher volume than you, so that we are better now. This is simple. But for that, to make it regulatory, we have to be first answerable to ourselves. As a doctor, we have to answerable to ourselves. We have to be passionate. If we want to remain doctor, we have to be passionate to our profession, number one. Rather than cribbing and blaming all other professions, first we have to see ourselves, correct our own medical system. Number two, people should start trusting doctors. This is very important. People trust Baba more than doctor. And any Baba can cure. That time Ayurveda discussion was going on. I was about to ask this simple question. Gomutra is curing cancer. When Ayurveda doctors objected to that fact, Gomutra can't cure cancer. That is not Ayurveda. I have read the Ayurveda. We have to control, make, just like Medical Council of India, we had, now it's the National Medical Council, we have to make Baba Council of India and decide what Baba can do, what Baba cannot do. Cancer cannot be cured with Gomutra and Bhabut and all those kind of things. Regulate. Why I'm saying this? Because cancer phobia, inability of treatment, and unaffordability of treatment force them to go to Baba. Very simple. We have to make the facility available, regulate them, regulated by the doctors who are credible enough to handle the system. And then, see, India can become Vishwaguru in healthcare, not only cancer care, healthcare, India can be Vishwaguru. Otherwise, it's not possible.
Right, sir. Right, sir. So, Dr. Dinesh, sir, like we are having, you said that India has a budget, very small budget for working at and uplifting the district level, that is at the grassroots level. But how are we managing the demand and supply of manpower in India? We see the maximum brain drain of young doctors, clinical staff that are reaching out to other countries. Yeah, we are unable to retain that. So how are we targeting that? Because education system is,
So-
I'm speechless for that word. for
Absolutely
education
right.
system
But
scenario.
this question we have been debating for I don't know how many years, and we'll continue to debate for I don't know how many years. Maybe few lives will go into this. So we have to really think of alternative solutions, execute them, prove them right or wrong, and move on. If we just keep thinking, if we just keep producing doctors is not a solution. So we have to find an alternate way of using existing resource, maybe dividing the work, maybe keeping a better technology to control the quality, better train. But you will have to start using only existing resource. You cannot wait for the new workforce. It's impossible.
And ma'am, how can we, how are we targeting at a corporate level? The same thing, including not just the manpower, because in a lot of organizations, healthcare organizations, in the private sector, I have seen staff is working 48 hours, 72 hours continuous. even in the government hospital, I will not name, it's a tertiary care government hospital, I myself saw a doctor working 72 hours continuous. Day 1 he was looking very smart and groomed, and by the day 3 his shirt was out, hair were all over. So how are we targeting that?
Yeah, I think that is not humanly possible because any person who physically and mentally can't work in such a crucial thing when we are dealing with lives, you know. So these are to be targeted by, again, what he said, that we should have some doctors for administration who knows what doctors are going through. And the syllabus is so tough, and you know the new doctors, the way they are producing new doctors, they'll get, because doctor is such a profession that you learn by experience. So you know those doctors need to be experienced to come into real fields. So I think that is the main thing, that that there should be some regulatory body to that. So regulatory body can come only from government. And people like you can make it as a target, you know, that such things is required now.
Regarding this conference, Afzal Bhai asked me to make this panel and come to a conclusion so that that particular chunk can be given to the policymaker, obviously not doctors, and that if possible can be implemented. Based on our discussion, this 1.5 minute clips, the technical people I am asking you, just cut it, tweet it to the government. If they believe me, after 6 months they can see the result. How more challenge I can give it? Just 6 months. Listen carefully. I told you 4P spectrum of cancer prevention. We have 60% cancer preventable. Food adulteration, we have to strict guideline by FSSAI. Food adulteration should be stopped from now. That can be food contamination, food adulteration, insecticide spray, chemical usage, everything. Prevention, healthy lifestyle, another prevention. There are so many things to do. How it's possible? Under one roof, develop holistic healthcare. Same existing infrastructure. As Dr. Dinesh was saying, no change, no extra facility. Same building will have Ayurveda and all the Ayush component in the same building. If a patient or person is coming, I am healthy, I want to remain healthy, tell me. Modern medicine doctor will evaluate everything, starting with pulse, BP to clinical science and everything. Screening has been done. Then lifestyle changes starting from yoga, pranayam to all the kind of yogic paddhati will be started. That is prevention. You are blocking disease development process, especially for non-communicable diseases, diabetes, hypertension, heart disease and cancer. You will see the result. Number 2, possibilities, second P. That is a screening process. Start the screening process doing all the centers, include the NGO even at the small PHC. Detect cancer early, cure will increase. Third is procedures and skills. Country will have uniform protocol. We have uniform protocol, means this cancer treatment should be done like this only, full stop, no discussion. And we have protocol, but it's not executable. Do it. At the same time, for procedures and pills, those patients coming from outside, medical tourism, virtual medical tour, start gaining revenue from those patients. For example, proton therapy, 30 lakhs. Out of that 30 lakh can be given to Indian patients. 30 patients will be cured by giving normal 3D conformal radiotherapy. Right? Means start generating foreign revenue, improve your quality assurance, give quality standard comparable to the Western world with low cost. Your revenue will increase, health revenue, health. And then palliation. Palliative care should be outside the hospital to decrease the cost. Hospice and everything. Don't invest money on ICU bed and hospital bed. That's all 4P. Just cover it properly, make a policy, do it for 6 months. If it is not working, take it out, scrap it out. Those who are doctors and like Dr. Rana, they can understand how much strength this has. But you can ask me, everybody are intelligent, including politicians and bureaucrats, but why they don't want to do? Because their income will go down and our people will remain healthy. That is the problem.
So as we say, the change comes from within. And I'm going to open-endedly question the audience right now that cancer is a lifestyle disease. So how as a community we can bring this change where we can actually not cure but prevent cancer and reduce the load on the hospitals. So this is my question to the audience. One from the audience, please.
Hello, I am Surendra Pandey from MMC Delhi. I am from Civil Society. So, first thing, our kitchens are just like a mini laboratory of आयुष. जो हमारी दादी नानी बताती आ रही हैं, अगर हम उसको करें, प्रॉपरली फॉलो करें. सिप्ला टर्मरिक का कैप्सूल 35-36 रुपए का बेचती है, जो हाफ कप ऑफ टी स्पून टर्मरिक जो है वो कैप्सूल में बंद करके देती है. लेकिन हम कभी घर पे अगर टर्मरिक दादी माँ कह देती है तो हम ओल्ड एज में चले जाते हैं. आपने गौमूत्रा की बात करी, इसको किस तरीके से अवॉइड किया जा सकता है? एनीपैथी इज बेटर विथ सिंपैथी. अगर आप किसी भी पैथी में ट्रीटमेंट कर रहे हैं, आपका जो मेन मकसद होना चाहिए वो पेशेंट को क्योर होना चाहिए. जो एलोपैथी का है डॉक्टर वो कहता है जी आयुष इज बेकार है. आयुष वाला कहता है जी एलोपैथी में जाओगे मर जाओगे. पेशेंट कंफ्यूज है. आपने डॉक्टर साहब अच्छी बात कही थी कि हमारे यहाँ क्या कहते हैं कि डॉक्टर्स जो है वो बिल बताते हैं पेरेंट्स को, फैमिली मेम्बर्स को. एक्चुअल में अगर हम लोग पेशेंट को खुद बताने लग जाए तो पेशेंट आधा क्योर वहीं से हो जाएगा.
बहुत अच्छी बात आपने कही कि घर में दादी कहेगी तो हल्दी नहीं खाएंगे, लेकिन 30 रुपए का कैप्सूल में कुरकुमिन खा लेंगे. साहब, मैं मॉडर्न मेडिसिन का डॉक्टर हूँ, लेकिन हल्दी पे कुरकुमिन P53 हाइपरमिथाइलेशन रिवर्स करता है कैंसर में. ये मेरा रिसर्च प्रोडक्ट है, इंटरनेशनल पब्लिश हुआ है. तो अगर मैं मॉडर्न मेडिसिन का डॉक्टर होकर आयुर्वेद की चीज़ों को रिसर्च करके निकाल सकता हूँ तो क्या कमी थी इसमें? लेकिन साइंस वहाँ तक है, उसके बाद बाजारवाद आता है, कंज्यूमरिज्म, कि जिस चीज़ की ख्याति बढ़ी लोग उसको उठा के बाजार में ले आते हैं, कंपनी लाएगी. हमारी ज़रूरत क्या थी? मॉडर्न मेडिसिन के फादर को हिपोक्रेट को कहा जाता है. 462 BC में उन्होंने ग्रीक में मॉडर्न मेडिसिन ऑर्गेनाइज किया, लेकिन इंग्लिश में ट्रांसलेट होकर मॉडर्न मेडिसिन पूरे ग्लोब पे छा गया. आयुर्वेद को हमने रोका कि संस्कृत पढ़ोगे तभी आयुर्वेद पढ़ने देंगे, नहीं तो पढ़ने नहीं देंगे. आयुर्वेद को हमने रोका है. और भारत के चिकित्सक होने के नाते मॉडर्न मेडिसिन प्रैक्टिस, मैं अपने को चरक सुश्रुत धन्वंतरी का वंशज कहलाना पसंद करूंगा, न कि हिपोक्रेट का वंशज कहलाना पसंद करूंगा. बेशक मैं प्रैक्टिस मॉडर्न मेडिसिन करूं या आयुर्वेद करूं. अब आपने जो बात कही, मैंने यही कही थी, होलिस्टिक हेल्थ केयर, इंटीग्रेटिव, एक छत के अंदर सारे सिस्टम को बिठाइए. जब कंपैरिजन होगा तब सच्चा आयुर्वेद निकल के आएगा. अभी आयुर्वेद कौन चला रहा है? आप बताइए. हमारी मेडिकल कंपनी जो होती है, दवा की कंपनी, डॉक्टर दिनेश, किसी की हिम्मत नहीं हो सकती है कि आके बता दे कि ये दवा खा लो इस बीमारी में, टेलीविजन पे बैठ के. लेकिन आयुर्वेद का एक व्यापारी बैठ के कह रहा है सुदर्शन घनबटी खा लो. तो साहब, आप तो मीडिया के हैं, क्यों नहीं पूछते हैं कि तुम आयुर्वेद के डॉक्टर हो, तुम बोल कैसे सकते हो? जरूरत है इसी की. न आयुर्वेद बुरा है, न मॉडर्न मेडिसिन बुरा है. इंटीग्रेट कीजिए, जिसमें जो चीज़ें अच्छी हैं सबको समाहित करके एक आंगन, एक प्रांगण में उतारिए. अल्टीमेट एम सबका होना चाहिए मानवता का विज्ञान. इसको पराकाष्ठा तक उठा के ले जाओ, यही हमारी सच्चाई होनी चाहिए.
So there was a time when
Ayurvedic medications का क्या है? There is no clinical trials, as it was mentioned initially also. Since we don't have trials, we don't have publications, we can't tell the results. So बहुत पहले जो हो चुकी है वो हमारी
मान इसलिए नहीं रहे. मैम, प्रॉब्लम ये है कि जैसा डॉक्टर साहब ने कहा कि अगर आपको आयुर्वेदा का डॉक्टर तभी कहा जा सकता है जब आपने संस्कृत पढ़ी हो. आपने तो इंग्लिश में सारा मटेरियल पढ़ा है, तो आपको अगर आयुर्वेदा में करेंगे, आयुष में करेंगे, तो आपकी रिसर्च को भी नहीं माना जाएगा.
देखो, मैं तो ये किसी पेशेंट को, एक पेशेंट्स कहते हैं टर्मिनल स्टेजेस में, ऑलवेज से कि फेथ इज इम्पॉर्टेंट, आप जाइए, But only thing is, अगर किसी आयुर्वेदिक मेडिसिन से कैंसर क्योर हो चुका होता, that person would have received Nobel Prize, isn't it?
जनाब इसको क्लियर
मतलब
करते चलते हैं. देखिए इसकी भ्रांति है बहुत बहुत डीप में. मैं बाय प्रोफेशन डॉक्टर हूं, लेकिन मैं इन्वेस्टिगेटिव जर्नलिज्म करता रहता हूं. आपकी जानकारी के लिए बता देता हूं, मीडिया में जाके पता कर लीजिए मेरे बारे में. आपके सारे जितने सो कॉल्ड मैं इसलिए कह रहा हूं कि आयुर्वेद नहीं है, जो प्रचार कर रहे हैं टेलीविजन पे बैठ के, उनके शिविर में जाके मैं मरीज की फाइल लेके मरीज का अटेंडेंट बन के मैं इन्वेस्टिगेशन टीम जर्नलिस्ट, मेरे पास वीडियो है, चाहिए तो चला लीजिएगा टेलीविजन पे, अगर चलाने की हिम्मत किसी मीडिया में हो तो. मैं दे चुका हूं मीडिया वालों को. एक मरीज कोई क्योर कर दे, मैं इस प्लेटफॉर्म से ओपन चैलेंज कर रहा हूं. आयुर्वेद को हटाइए, मैं कह रहा हूं वो आयुर्वेद नहीं है जिसकी बात मैं कह रहा हूं. उनको मैं चिट्ठी लिख चुका हूं, मेल कर चुका हूं, उनके शिविर जा चुका हूं कि एक मरीज ठीक कर दो तुम अपने पद्धति से, सिर्फ अपनी पद्धति से. मैं अपनी पद्धति छोड़ के तुम्हारी पद्धति को अपना लूंगा. क्यों चैलेंज नहीं ले रहे हैं? चाहे हिमाचल हो, चाहे उत्तराखंड हो, चाहे राजस्थान का अलवर हो, हर जगह मैं जा चुका हूं. चैलेंज क्यों ले रहे हैं? मुझे चैलेंज कोई करे कि अगर एक मरीज कैंसर का ठीक करके दिखा दो, मैं कहूँ एक नहीं यार, 1 लाख मरीज ठीक हो चुके हैं, चलो आ जाओ देख लो. साइंस हर समय प्रत्यक्ष और प्रमाण मानता है. साइंस को दकियानुसी बातों से कोई लेना देना नहीं है. और जब तक हम वर्ल्ड स्टैंडर्ड पे खड़ा होना चाह रहे हैं तब भी खड़े होंगे. जो हम कर रहे हैं अमेरिका में कोई करे, सेम रिजल्ट मिले, तभी वो साइंस है. साइंस इससे नीचे नहीं मानेगा.
One last, I have a question. So there was a time when cancer, किसी को अगर हो गया है, we used to hear that that person has a cancer, that person has cancer, and I am sure right now that everyone sitting in this hall must be knowing someone in their relatives, family, friend having a cancer. So again, my question is to the audience right now: how accessible do you feel as a cancer treatment or the cancer infrastructure to all of you? Anyone to answer this, please?
Hi, Shruti. This discussion is going very awesome, and I really appreciate Dr. Anushuman, sorry. You brilliantly just put up your point very clear. Hope the lousy Indian government policy, the healthcare policy, will bring some measurable impact into this. Okay.
आप डॉक्टर हैं क्या?
No, I'm not doctor.
दर्द आपका छिपा डॉक्टर जैसा है.
So because I lost my my step brother because of the cancer 3 months before. So he was also being diagnosed in the Paras hospital. I will not go so deeper into this. You understand the healthcare system is, because it will make a bad impact in the healthcare system, the big hospitals. What I want to bring attention, because Shruti started questioning that how we make, as a citizen, as a people, reduce the bill, the burden of this cancer things, and reduce the burden of the hospitals. Like the Indian, let's say Indian law is crowded with the cases. Same with the healthcare industry. They are crowded with the multiple cases. We as a middle class family, somewhere being being affordable to such things, very 30, 40, 50 lakhs, 1 CR, there's no limit, no cap in cancer things, right? But what about when I see the people outside, they are selling their land, properties, everything, but still they are not saving their lives. So what I am going to suggest, everybody knows it, it starts with the lifestyle. This starts when you leave the bed, right? So when we are very precise how we are leaving bed, what is the time, what is our intake as part of the, let's say, what the water we are taking, then the food we are taking, what we are restraining not to take, something as a meals, what is our day plan, workout, everything. Start with that, because whenever you just diagnose with cancer, it is not just a one-time event. It's like a years of impact, right? We have been just eating food for the long time, or street food. Then this is an impact. This doesn't happen just overnight, right? So we have to work from the very beginning of the day we are starting. That can actually help, let's say, create a wellness, awareness. And Indian are very, let's say, they follow the things. They are so inclined to the politics thing. They don't believe. Even you are guiding here, you are making impact. After that discussion, everything will be over, right? Everybody will back to work. Nobody improved the beginning. But at least I believe 1% is going to improve that. So I'm a father of two. I believe that since the next morning I'll improve myself and trusting that the other stakeholders who are sitting here going to improve their things. So this will save them, their family being affected from such very dangerous disease. This is from my point. I'm not coming to the second question because I didn't think about it. Thank you so much.
Ideally, health should become a cult. Health should become a religion. That is most important. We are not taking it seriously. Health means swasth. Swasth is, health is not mere absence of disease. It's physical, mental and social well-being. और आयुर्वेद कहता है समदोष समग्निश्च समधातु मल क्रिया प्रसन्न आत्मेंद्रिय मना स्वस्थ इति अभिधीयते. सभी चीज़ों की समावस्था में हो जाना ही स्वास्थ्य है और उस पर काम नहीं कर रहे हैं. डेनमार्क में कॉन्सेप्ट है हाइकी का, स्वीडन में लाइकी का कॉन्सेप्ट है, जापान इकिगाई इचिगो इची का कॉन्सेप्ट है. देयर आर सो मेनी कॉन्सेप्ट. इंडिया में भी हमारा था, लेकिन हम सिर्फ वेस्टर्न वर्ल्ड को कॉपी करते करते अपने सारे पौराणिक चीज़ों को छोड़ रहे हैं. यही प्रॉब्लम.
So I guess we are having a very hard stop time again. I have so many questions to ask as an open-ended that we cannot cater right now. Thank you panel, thank you everyone. Thank you for being a wonderful audience. It was a great interaction with all of you.
Thank you so much to our esteemed panelists for such an inspiring and thought-provoking session. Your insights have truly enlightened us and sparked meaning conversation. We are grateful for the time, wisdom, passion and the journey you shared today. Now let me invite Mr. Afzal Kamal and Dr. B.K. Rana to facilitate the panel. Dr. Anushuman Kumar, Principal Director, Onco Max, SS Hospital, Noida. Dr. Dinesh Pendarkar, Director, Oncology, Sarvodaya Healthcare. Dr. Sapna Verma, Oncology, Radiologist, Apollo Hospital. Architect Shruti Gupta, Healthcare Facility Planner, Max Healthcare. It's time for a group photo now. Thank you all the panelists.